Good afternoon and welcome to another Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. Our doctors, as always, let's see, which way do I go this week? Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health.
Hi, Eric.
How are you?
Great.
And Dr. Dave Jetmore, Wayne County Health Officer. How are you, sir?
I'm fine, Eric, and you?
I'm great. Always good to have you all here. Again, we definitely appreciate your time. Thank you for joining us this week. How's the week been? Let's start. I said hello over here, so let's start here. Based on what you've seen, talk to me about this past week.
Things are continuing to go well from the standpoint that our positivity rate is still low. It's at 3.1%, not risen from last week. And that compares to 4.4% for the state, so we're doing well. I'm still have some apprehension when I look at that state map and I see all those orange and yellow counties right at the Michigan border. And of course, Michigan has the highest rate of COVID of any state in the United States. But so far, so good. I'm still seeing a lot of people wearing masks, which is a good thing. And we're continuing to vaccinate. I think that the big story for the county, the state, and maybe the United States is we're seeing more reluctance to be vaccinated, where our vaccination numbers are starting to decrease. And how that will play out in the future, we'll just have to wait and see.
The governor signed a couple of executive orders, one of them extending the state health emergency until the 31st of May. From a public health standpoint, what does that mean for you all and for us?
Well, it's it's been, he changed the mandatory requirement to wear a mask to just an advisory. I think masks are still required in schools and in public buildings, Indiana public buildings. So that's basically what he's continuing. And for people that are coming in to be tested, they also have to wear a mask.
Okay. Sir, your week.
Well, it's been kind of a quiet week, actually, on the COVID-19 front. Not a lot that's different. There's all the time new studies and things in the news to one degree or another, but I think basically things are more or less status quo. And I'm cautiously optimistic that we're on a decent pathway in terms of the rate of new cases and whatnot. But I think the caution for us is that we're still having them. Really, when we get to the statistics, we'll see that while there's some ups and downs, we're kind of flat. They're not going away. I also was looking at the state is now kind of keeping a summary of variant viruses in the state, and actually are up to about a couple thousand identified samples that are positive for one of the variants or another, and there have been significant numbers of virtually all the major variants. The 5 that are the variants of concern have all been seen in Indiana to one extent or another. The most common is the UK B117 variant. That is something like 870 samples that were tested positive. And the way that doesn't mean there were only 870 cases. There are actually lots more than that, and that they are simply taking random samples from the Sentinel labs around the state of positive swabs, and that's a little bit worrisome that we're seeing that level of variant viruses in the state. But we've seen significant numbers of all the others. There were quite a few of the 2 California variants. They're kind of lumped together in the state statistics, but there's 400 and some cases of those in this sampling. And they've even seen a few cases, of the Brazilian variant that caused so much trouble in Brazil a month or so ago, and which appears to be much more easily transmitted and causes more severe illness, and maybe at a younger age. So and then the very few cases of the South African variant. So I think the numbers of variant viruses are going to grow, and really the key to getting a handle on that is to get more people vaccinated, because as there remains a significant pool of unimmunized people out there, they're just going to serve as the basically the petri dish for viruses to further mutate and spread. And so I just wish we could do better on vaccination. The rates are really low.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, CTV Channel 21, streaming on Facebook. Also on our Facebook page, we're taking your questions for the doctors. So if you have a question that you want to ask the doctors, you can put it on our Facebook page, or you can send it to Twitter at WCTV Info. I got a press release from Reed Health. I mean, it was, I'm scrambling to come down the hallway and it comes up, so I had to take a quick peek.
This afternoon.
You're doing walk-ins now at your vaccination center at the Coleman,
Right.
at the Coleman Center, which wasn't always the case. You were kind of discouraging that as much as possible. Now you're just at the point where you want people in.
Yeah, we're now at the point where the scheduled visits have dropped off, that the volumes are such that it's not that hard for us to handle the walk-ins. It was never that hard. It's just that if you don't pre-schedule it and fill out all of the intake information, then it slows down the process a little bit once you get into the Kuhlman Center. But now the volumes are down to the point where we can handle that without causing any slowdowns in the process for the people who have scheduled. So, and if it helps people to say, I'm just going to decide right now, go get vaccinated, and not have to take time to figure out how to get scheduled and set aside time to do it later. If you sort of become alert to the fact that, hey, I've got an hour, maybe I should go get vaccinated, just come and do it. And I'm sure it's more or less the same for the Elder Beerman site, although I think we're only doing several days a week right now there. We can talk about that. We will do walk-ins at our other sites. We're kind of running a little pilot project on what would it be like to, and what would be the problems or issues we'd have to overcome to make it work to do vaccines in an even more distributed fashion in some of our offices, like we're doing them in our urgent care centers now in Richmond and in Connorsville. And those are scheduled preferentially, but you know what? People have walked in saying, oh, can I just get a shot? And we try to take care of them. We haven't turned anybody away on account of not having been pre-scheduled. We're also probably going to start doing them at the Ready Care, which is the tiny walk-in clinic in the Meyer grocery store, and looking at doing them in some other of our offices. Again, it's just about making it more readily accessible in the places where people happen to be. And so we're trying to work on thinking outside the box and not be constrained to the Kuhlman Center. People have asked us, well, what are we going to do with the Kuhlman Center since the volumes are down? And I don't have...
The fair is saying they're going to be having events.
Yeah.
You're where the photography and stuff like that would normally be, the baked goods.
Exactly. And we had already arranged with them that to take a break. We weren't sure what that meant for us exactly, whether we'd still be trying to do some things at the fair, just in a different way, but so that they could use that building. And that would allow us to give our staff a little bit of break, because we have some people who've been really putting a lot of extra hours, working regular jobs in the hospital or in other offices and coming out there to vaccinate, and we want to give people a break, so we thought that would be a good opportunity. So that's still the plan, but we are starting to talk with the team at the health department about, can we still do a very small pop-up activity at the fair, particularly with using our Pfizer vaccine, which they don't have, because it can be used currently down to age 16. And by the time the fair comes around, the age, we're thinking, just not sure, but we're thinking that the age will be reduced to 12. Pfizer has applied for modification of the emergency use authorization to allow its use down to age 12. They had data on that when they first filed for the EUA way back last fall. It's just that they didn't have very many people in the phase 3 trial data under the age of 16, so the FDA chose not to go under 16 with it, but they had a little data on 12-year-olds, and since then have continued testing in the younger age demographic there, 12 and up. And they recently presented that information to the FDA, have asked for emergency use authorization. We're told that the committee that looks at this, the Advisory Committee on Immunization Practices of the CDC, will have a meeting to look at that data and make recommendations on May the 5th. So at some point after May the 5th, we're sort of thinking that they'll say it can be used down to age 12. Well, that's just Pfizer. Moderna's not in a position to ask for that yet, although they are testing in younger age groups. So we're thinking that by the time of the fair, Pfizer will be a go for 12 and ups, and that's why it might make sense to make Pfizer available still at the fair, just not in the Kuhlman Center. So we're talking with Dr. Jetmore's team on what would be the best way to try to do that.
And what's your team's reaction?
Well, we want to, I think the force that drives all of us is getting as many people vaccinated as we possibly can. And I think the state is trying to make that happen by making it as convenient for people as possible. I saw a press release today from the Indiana State Department of Health letting people know that they could come in without an appointment. They could get a ride there for free from Lyft or Uber. If they're having to take time off work to come and get the vaccine, the government will give their company a tax break to cover the time that the person will be gone. So they're doing everything they can to make this as simple and easy for people as they possibly can. And hopefully that'll be effective because, as Dr. Youth alluded to, the more people we get vaccinated, the less bodies that are available to the virus to mutate. So hopefully these things will be successful.
You all are operating your vaccine clinic in the Elder Beerman site 3 days a week?
Tuesday, Wednesday, and Thursday.
Walk-ins are?
Walk-ins. You can walk in if you're uptown by Elder Beerman. You can walk in the south entrance from the parking lot at Elder Beerman and be vaccinated.
Check out one of the new bakeries, then go get a shot.
That's right.
So
Check out.
Get the shot first.
The
And make
bakery afterwards is a
reward.
Bakery, okay. Bakery afterwards is a reward. However it is you want to do it. Are you all, as a health department, public health department, having a lot of conversations? I know that you all have had conversations all throughout the years with the school systems. You have talked numerous times, both you and Christine, as to how well the superintendents, nurses, things of that nature have worked with you all. You're coming to the end of the school year. Is there a conversation about what some of the schools should be doing about commencements? Last year, I know there was a big thing. This year, where are they, and what are you all advising?
Well, it's up to them on whether or not they want to have a commencement or graduation exercise of any kind, but it's going to involve masking and social distancing and somehow cutting down on the number of people in attendance besides the graduates. We're sympathetic with these graduates. That's the cherry on the sundae, that ceremony, and you get your diploma. But of course, we want everybody to be safe. The more people we get vaccinated, the safer it'll be.
You're watching Ask the Doctors on WGTV Channel 11. We're taking your questions on Facebook as well as on Twitter. I think we're going to move your statistical segment up just a little bit
Okay.
so that we can begin to talk about that. But talk a little bit, both of you all, about what you're seeing in this area. The J&J vaccine has been released again for use. I assume you all have begun using that again, or have you?
No, we have.
Okay.
It's the chances of having a clotting event it's a possibility with the Johnson & Johnson vaccine. People are warned about that. The chances are 1 to 2 out of a million, so they're very, very slight. The appeal of the Johnson & Johnson vaccine is it's a good vaccine and it's a one-shot vaccine. You get the vaccine, you're done. You don't have to return for a second shot.
You've both have, I'm sorry, there's a voice in my ear that there's a question related to this.
I've heard that voice.
Yeah. Uh-oh, we're sharing voices now. So let's go ahead and take the question that's related to the conversation we're having right now. Has anyone in Wayne County suffered from blood clots as a result of the J&J vaccine?
No.
No.
Nobody's suffered a blood clot as a result of the J&J vaccine. And you wouldn't expect that to happen. I mean, the chances of that happening are so remote that's not surprising.
Yeah,
No
not to
one in
my
the hospital
knowledge.
presenting, and you all have, and you have on multiple occasions talked about you all are reporting almost everything you see, whether you feel there's a correlation or not, even if there's a possibility, you all are trying to put information out.
Yeah, that's right. I mean, we have I think people need to clearly understand that as healthcare providers, we have a duty to try to help the national authorities determine whether there are any unforeseen problems and side effect possibilities. I know of about 10 vaccine adverse event reports that have been filed by either us directly or by some of the doctors who are associated with us. And virtually in all those cases, there are situations that are not things that are described as having been related to vaccines, but they're out of the ordinary. They occur shortly after the vaccine, after getting vaccinated. And when you think about it, you give 230 plus million doses of vaccines, which is about where would have been administered so far from all the vaccines combined, and we focused on initially on people who have lots of what we call comorbidities. They have lots of underlying problems. They have age, they have heart problems and lung problems and neurological problems and diabetes and other issues. When you give a vaccine to 230 million people, you can just count on it that some people are going to get sick soon after, having nothing to do with the virus, or the vaccine, I mean to say. And it's just a matter of odds, so it goes back to the old scientific concept that, correlation is not causation. You have to do more digging and determine whether there's actually a correlation there. And so, therefore, when we see something out of the ordinary, we want to get it into the system because it may not seem like much to us or that it's related, but when all that data is aggregated by the federal authorities at the CDC and the FDA, then they can begin to draw correlations. That's how this came up with the Johnson & Johnson vaccine in these 15 cases in young-ish women particularly. I think all the 15 cases were women in the U.S., but with AstraZeneca in Europe, it was about 3/4 of the cases were women. They had a much larger series of patients with similar things. This combination of blood clotting problems, particularly in unusual places, combined with very low platelet count. Platelet count is part of the blood clotting system, and when we see very low platelet counts, we usually think that people are prone to bleeding problems. But with this particular situation, they're actually prone to blood clotting problems, and it has to do with an immune system disturbance that causes antibodies to be formed to a factor on the platelets, which are a blood cell that participates in blood clotting. It's called platelet factor 4 that antibodies are formed to. And it's very similar to a situation that we can have when certain blood thinning medications are used in people who are susceptible to this problem. In that, it's called heparin-induced thrombocytopenia, which is heparin's the drug, and it induces in some people, rarely, a drop in the platelet count due to antibody formation to this platelet factor 4. But instead of having bleeding problems, they are prone to blood clots. Really a lot of similarities between those conditions, and that's what drew people's eyes to it. But all that came about because of all the reports that people are putting into the vaccine adverse reporting system. So that's why we make those reports. It may seem like it's not related to us, but when they aggregate all this data, they can begin to draw those connections. So we take it as a very important duty and obligation that when something unusual happens, within some time, a period of time after getting vaccination, it doesn't matter what vaccine it is actually. You do this for all vaccines. We make reports. We have done this many times with other vaccines, and we've, as far as we can tell, all of our reports have never amounted to anything. But we do that, and in the case of the coronavirus vaccines, we have done, to my knowledge, around 10, there could have been more, vaccine adverse event reports. We just put the information to the system, even though these situations don't seem like it, and that like they're related. And it's things like older folks with heart problems. I'm aware of one situation like this, an older person with known heart problems who'd had several heart attacks in the past, got vaccinated, and then like a week later had another heart attack. Is that related? I don't know. But because the standard is within a few weeks of a vaccination, if anything out of the ordinary happens, we make the report, so we file the report. And that's how, over the long term, across the whole country, the accumulation of data may help that, hey, is there a relationship? Can the vaccine cause people who, with certain configurations of problems, are they more likely to have that problem? I think the answer is no, but only by looking at the statistical data can you figure that out. So we have done a number of those reports, but to my knowledge, none of those really, to us, seemed like there was strong correlation there.
Based on what you know, and obviously you're keeping up with a lot, but maybe not everything, have any of these been strong enough reactions that these people have had to be hospitalized for it?
This question has come up several times, and it's come up again recently, and so I've gone and asked around. I would normally be made aware of, oh, hey, we think this is something related to a vaccine. In all these other cases that I've talked about, people brought these things to my attention. I would think I would have been made aware if somebody had been hospitalized with a highly suspected complication of a vaccination. I was not aware of it. I asked around to the ED, to the emergency room doctors, to some of the nursing supervisors, people who monitor and the flow of patients into the hospital. And nobody could really come up with any specific situations for me where we've had admitted to the hospital somebody with an actual complication to vaccine. And yet we hear these kind of anecdotal reports from people outside the hospital. Oh, the hospital's got lots of patients admitted and they're just keeping it quiet or something. That's not happening. Now I can tell you that there have been, I'm aware of 2 situations where frail, much older folks, when we were concentrating on their vaccinations, they had some of these intense immunologic type reactions that we expect. The fever, the headache, the feeling fatigued, weren't eating or drinking, got dehydrated, came to the emergency room to get checked to make sure there wasn't something else wrong, and then got some IV fluids and went home after being evaluated. There were a couple situations like that, but again, that's like 2 situations I'm aware of out of now. It's over 30,000 people, I think, is the number in this county that have been vaccinated. So, we can expect things like that to happen. So those don't trouble me particularly. And, sometimes I get questions. I mentioned the situation about somebody that had a heart attack, had history of heart problems, had a heart attack. Should we report that or not? Yes, we reported it, but we don't think it's related. That's about as far as it goes. I'm not aware of anybody, and I don't know every, we have dozens of admissions on a day, dozens of discharges. So could something have snuck in and out and I was unaware of it? It's possible, but I would say this, if anybody, whether it's Dr. Jetmore or you or the guys in the control room or any of our viewers are aware of specific situations that they think that were related to vaccine, people happen to be hospitalized, I want to know about it so I can investigate it and make the appropriate reports. That's our duty, and we feel very strongly about that. So that I just want to leave it at that. I'm not aware of anything, but if somebody else does, whoever it is, let me know. Find a way to let me know so we can look into it and get the facts, all the facts, and make the appropriate reports. And I can tell you we have a very low bar for making the reports. If we even think, I wonder if I should or not, we just do it.
Okay. You're watching Ask the Doctors on WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We're taking your questions on Twitter at WCTV Info, and also on Facebook. You all have tried a couple of pop-up, taking the mobile unit out, not in the snow, but taking the mobile unit out. Are you all planning, working on trying to do that again, or have the levels been so low when you've done that you're thinking we need to refocus, we need to rethink?
Well, the problem now is, and of course, we'll always have a use for that mobile unit for reaching out for childhood immunizations in the latter part of the summer and for a number of things. But we took the mobile unit to Hagerstown to have a group vaccination. Only had eight people come to get the vaccine, so we have to balance that. I mean, if there's no demand for the vaccine, then obviously, the cost of using the van and the manpower to send that out will go away. We encourage people, anybody that's in a group, like a fraternal order, maybe a large family, maybe a church, if you've got 20 or more people, we're willing to come to you and we'll vaccinate that group. It's just a matter of calling the health department. We'll set up a time and we'll make that happen.
Okay. We'll make sure that the health department number is available. So if you are part of a group, and you mentioned churches, other organizations, want to be able to do that, definitely do that. I mentioned we were going to move your numbers up a little bit. We always end up pushing those back a little bit and maybe rushing you through them. If they can, in the control room, begin to pull those up, we're going to move that up and then begin to deal with some questions or other conversations.
Okay, sure, let's do that. So these are the Wayne County numbers just over the last, 8 weeks or so, maybe 10, something like that. Really, we can see that the numbers in that time period have been kind of up and down, but generally kind of sideways moving. Yeah, maybe you can kind of see a slightly downtrend, maybe. But don't let that last bar fool you. It's actually estimating that we'll wind up this week with about 49 to 50 cases. So it'll be kind of comparable to the last few weeks. And that's our estimate on that. So just status quo.
Does that continue to be a troubling situation for you all, that the numbers can't seem to drop? What is that saying about the community to you all, that we stay in that same weekly number? We still have the spread. We're still seeing people.
I know what you're saying. You want to see that number go down every week. We'd like to hit zero. But basically, we're at a steady state here at around 50 cases. I think it'll be 55, 52, 49. So that's basically unchanged over about a 3-week period. So it's it fills you with a feeling of caution of what's to come. We'd like to see those numbers go on down. But this tells us that, with these lab positive cases, that there's COVID-19 virus in our community. And these tests prove that.
Sorry, just needed to.
That's a good question, and I think that there are things about how viral transmission works, the sort of the characteristics of pandemic that we don't really fully understand what drives them up, drive them down. If we didn't have vaccine and we weren't doing anything special or weren't distancing or using masks, would see an up and down thing on this over time for reasons of its own, that again, we don't fully understand all of the dynamics, only some of them. So
Even
we
with
can't
all the masking,
explain all
even
that.
with all the potential vaccinations, we're still seeing numbers not change.
Yeah, but
I would expect something
you would
different,
make
but
a case that we are at least taking some people out of that pool of vulnerability, and maybe without the levels of vaccination that we have, the numbers will be twice as high or some factor higher, but still kind of sideways. I don't know. All I can tell you is those of us who've been vaccinated are much less likely to come down with it now. It's not perfect, but we do have very good protection.
okay.
If we go to the second page there, and those are the read numbers over about the same time period, we can see that there's been a dramatic lowering since mid-February, but over the last 5-6 weeks, we are also moving kind of sideways at read. And that last week is the week so far. We're averaging about 6 known lab positives in the hospital, 8 people in isolation, and really for over 2 weeks now, we've had 1 person on ventilator. Very, very sad situation. Who I think was yesterday or today, be getting a tracheostomy because have been unable to wean this person from the ventilator, and that's very, very sad. And we don't like that. So, but it's only 1, so I guess things could be worse. It's just the 1. Okay. Then the last page is just something on vaccinations, that different way of looking at this, kind of on the READ service area that I've abbreviated as RSA. That's the second from the bottom line. We can see the vaccination start rates, meaning the percentage of people who've at least gotten started with their vaccination process, and in the whole READ service area, which is 7 counties in Indiana, 2 in Ohio, it's just under 30%. And then I have the 2 counties that are kind of maybe more central to that, where this show is broadcast, Wayne County, Fayette County.
Tom,
yes, sir.
let me interject something here. Is this percentage of all the people?
Yes, entire population.
The entire population, not just 16
right.
on up. Okay.
And it's a little bit harder to come at that on the granular basis, but basically it would probably be in the 30. I think it's about 37% of 16 and up have been vaccinated in Wayne County. So you just basically move everything up about 5 or 6 percentage points. But all the numbers would kind of be move up together, basically. Wayne County is hovering at just under 35% of total people vaccinated, and Fayette County is probably about 27%, something like that. But I think the thing, and they have the comparisons. Indiana curve, Ohio curve is even better than that in the U.S. Overall. The thing about this, Eric, is that when you look at those numbers for the service area for the 2 counties, Wayne and Fayette, you can kind of see that they're plateauing over. They're not continuing to go up at the same rate that the Indiana, Ohio, U.S. lines are.
Right.
That's a problem. We have a lot of vaccine. people say vaccine hesitancy, and there probably are some people out there who are hesitant, who are thinking, should I, shouldn't I? Maybe I'll wait a little bit longer. I'm sure those people are out there. But I think we've gotten through all the people who are what I call vaccine eager. They're done. They've been vaccinated. A lot of the vaccine hesitant have either decided that they're going to get it and have gotten it done, or they're never going to get it. So they go into this camp that I call vaccine averse. That's what we're left with, is a lot of vaccine averse people who are very, very hard to convince to become vaccinated. And I think this plateauing over, we're probably going in Wayne County, we're just going to plateau and maybe never get much above 35% of the total population vaccinated, unfortunately. At least that's the way it looks like now. If you just kind of in your mind draw out, where is that curve going? It's not a straight line, it's a curved line that appears to be vaccinating and that appears to be plateauing. And so that's kind of the bad news in all this, is I'm not sure what else we can do except try to get at specific places where we can find those hesitant or delaying people and kind of get to them in the manner that we've already discussed. Take it to them, get it to places where it's convenient for people to just, take a few steps this way and get vaccinated, and they're just haven't bothered to go through the steps, put the energy into getting the vaccine already. Or like we've talked about at the fair, we'll do, by then maybe 12s and up will be able, and we'll still have it there that people coming into the fair can get vaccinated. And all the other things we've talked about already in terms of getting it out to people.
I'm just curious. You all, I've been sitting here between you all for well over a year now. Talk to me about where you thought, you always knew that there was going to be a point where this would probably plateau. Are you surprised that for this surrounding area, that it has kind of hit that point as, I'll say, as low as it has? We haven't hit 40%. We haven't even really hit 35% for the most part here in Wayne County. Are you surprised that the number has kind of topped out at a third of the population?
Well, I am. I'll speak first. I'm sure Tom's got a lot of thoughts on this. I thought it would peak out at around 60 or 70%, and the reason I say that is because nationally, I don't know of a poll that was conducted in Wayne County, but nationally, 30 to 40% of people in the United States were telling the pollsters no, they're not going to get the vaccine for various reasons. So therefore, I thought we'd reach 60 to 70% and not kind of peak at 30 to 35. So that's kind of disheartening. I remember we were talking about the vaccine last a year ago. It was the holy grail. We thought, please God, let's have a vaccine and we can get over this. And let's have enough vaccine. So now let's have a good vaccine. So now we have a good vaccine, a plentiful vaccine, and half the people don't want it. So there you have it.
Over half, looks like.
Yeah.
But, people try to read into it and say, well, it must be because of this or that, and they've done there have been done, news organizations and other outfits have done like surveys, what's causing people to be, what are the correlates to vaccine hesitancy? And people will make correlations between political affiliations, like Democrats are more vaccine accepting and Republicans less so. And I think those are too easy an answer. So I don't think we may not completely understand what's going on there. If you look at the state has, they show the statistics in a slightly different way, but you can easily convert to percentages. Some of the counties surrounding Marion County have the highest vaccination rates in the state. They're in the 16 and up category. They're in the 46 to 50% range. The ones that are north of Marion is, I think Hamilton County and Boone County are the highest in the state. They're in that range, 45 to 50%. Marion County itself, which does not vote Republican, is one of the lowest in the state. So there are easy answers that aren't necessarily right, but I think that there are a number of factors. I think that there could be a dimension of people in rural areas kind of feel like, if I'm living in a less populated place, I've already got some degree of built-in distancing, you know. I'm not getting into large crowds just by walking down the street, and so feel less vulnerable. And therefore, is a vaccine that valuable to me? If I lived in a highly densely populated area, maybe I'd be more interested in that because I have to be around so many people all the time. So I think that's another alternative way of looking at it that I heard somebody talk about the other day. So I think that there are probably dimensions to this we don't understand. I wish folks around here would be more accepting of it, and I think really the way to look at it is that they're looking at it as, do I get vaccinated or not? And they're basing that on, well, what's my sense of personal risk? They don't have a high sense of personal risk. But really, to me, the right calculus is, do I get vaccinated or do I get COVID-19? Because if I don't get vaccinated, I am probably at some point going to get COVID-19. You know, it may not be tomorrow, but you know, at some point it's going to happen. And would I rather have, you know, the short term, you know, 1 or 2 days not feeling 100% versus the potential long-term effects of COVID, which about 50% of people who have active COVID-19 disease of any severity, even low severity, have some type of symptoms at least 4 months later, and that's as long as they've done the studies.
50%?
Yes. And it could be minor symptoms. It could just be, I don't quite have the same energy that I had, or my sense of smell is not back. But some people have more significant symptoms. I get winded more easily when I exert myself, and that isn't, you know, my stamina is not back. Or they feel fatigued or have, you know, mental fogginess. I just can't think as sharply as I used to do. So all those symptoms were in there, and the ones I've mentioned were the common ones. But there are a variety of other symptoms as well. So, you know, we shouldn't think of COVID-19 as you get a cold for a few days and you're fine. It's because actually there are some longer lasting effects.
Have we made it sound like it's that way based on the fact that there are now some therapeutics and things that have eased the suffering, for lack of a better way of putting it?
Yeah, I guess we could have, but I think a lot of people have now become aware of the fact that, at least in terms of the death risk, the risk of death, if you're under the age of 60, it's very low. But death isn't the only negative
Downside.
outcome.
And when people
So-
imagine that the people that don't want the vaccine, when they imagine themselves having COVID, I think it's probably the asymptomatic brand, or maybe the COVID that has really mild symptoms. Mm-hmm. But I think you point out a very important thing, Tom, is that this, you know, when you get the regular flu, you get sick and then you get well again, and you're like you were before. When you get COVID, you may never be the same again the rest of your life, for all we know. I mean, these things, like you say, they've persisted as long as the study's gone on. They may persist for life. So that's another reason to get vaccinated.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. I've been saying that we've been taking your questions. We have been doing that. I've kind of hogged this one. I'm sorry. Let's get.
We're pretty good at asking and answering our own questions, I guess is when you get down to it.
Well, we see them in a number of places, and we want to go ahead
Yeah.
and respond to some of those that we see. But let's see one on the screen and actually have you all respond to that. Are you still seeing significant numbers of COVID infections in long-term care facilities?
That's a really good question. The answer is here locally, there have not been any big outbreaks. It's probably been at least 6 weeks since we've seen an actual infection in nursing homes. Now, there are a couple things that can cloud the discussion on this. I have noticed that because I work in long-term care facilities in my clinical side hustle, I have noticed that there are some long-term care residents who had active COVID-19, like way back in December. I'm aware of 2 cases from the end of December who are still testing positive by PCR now. That's a really long time.
Yeah.
And once you get outside the 3 months from the acute infection, the public health authorities get a lot more interested in, hey, what's going on here? Is this a reinfection or what? And so they've, in the 4 cases that I'm aware of, all had extra studies done. But in all 4 cases, they turned out not to have acute infection. They had other problems, and they were just were still testing positive by PCR. And so when you hear the uninitiated, people aren't familiar with all the nuances of this. Here, so-and-so's tested positive for PCR and they're a long-term care resident, OMG, are they having an outbreak? That appears not to be the case. So we haven't had any acute cases here locally that I'm aware of. But there is a long-term care administrator who's telling me that in her company, in other parts of the state, there have been some what are now being called breakthrough infections in buildings. And somebody told me that there might be a facility in Darke County, Ohio, that had one of these breakthrough infection outbreaks.
And when you
I
say
don't know the
breakthrough
details.
infection outbreaks, go ahead and.
Yeah, that meaning these in facilities where a lot of people have been vaccinated already. I mean, in the typical long-term care residential facility, 90+% of the residents will take the vaccine, but 50% or less of the staff do. That's the typical scenario. It is that way in about every long-term care facility everywhere, as far as I can tell. And so the CDC, the state departments of health are really actively looking for these situations to study if they get outbreaks, new outbreaks of COVID-19, try to understand what's going on there. Because you would think that with so many of the residents vaccinated, you shouldn't have outbreaks. But last week, there were 2 reports in the Morbidity Mortality Weekly Report about these breakthrough infections. The first that I've seen on them in terms of having actually published studies. One was in a large facility in Kentucky where about 80 residents became sick and around 50 or 60 staff. They had the typical proportion of 90+% of the residents had been vaccinated. Less than half of the staff had been. And there were 70 or 80 residents who became sick, a significant number of staff. Many of them had been vaccinated. There were 3 deaths, 2 amongst residents who were not vaccinated. 1 was a resident who was vaccinated. And they're trying to figure out what are the lessons learned here. And I think that there are a number of lessons, one of which is that we know that the vaccines are very good, but they aren't perfect, especially where there may be lower levels of immunity that are generated when you take older, frail, immunologically compromised people because of medications or their underlying medical conditions. They just don't mount the same immune response typically compared to younger folks. And so their immunization may be, for some of them, may be kind of incomplete, and they're still kind of susceptible depending on how much they're exposed. But then the other lesson is that the real key to preventing outbreaks in long-term care facilities is for the staff to get vaccinated, which has been a very great challenge everywhere. And because if they don't bring it in, it's that transporting the virus in that gets it started. We've noticed this from the beginning of the pandemic, that's what happens in long-term care facilities. Staff or somebody who regularly comes in and out brings it. And, so those are the underlying lessons. So these breakthrough infections happen. They haven't happened around here, at least not yet. And I know that all the long-term care administrators around here are still really trying to educate their staff about the benefits and the staff's responsibility to the patients to not accidentally bring it in. And so it's a work in progress, but I think that, it's a very great challenge to get everybody vaccinated who should be. I've answered your question in kind of a long-winded way, but that's the answer.
We got it. Doctor, I'm going to turn to you. We've got about 6 minutes or so left. The CDC and the president, I guess, kind of laid out some new guidelines for vaccinated people not wearing a mask if they're outside and not in a crowd. Okay, can you break it down for us a little bit? The news normally gives us the 30 to 45 second soundbite portion of it. Talk to us as we head into sunshine, what we need to know.
All right. I think the government wants to make being vaccinated more and more appealing so people will get vaccinated. And obviously, one of the great benefits of being vaccinated is not getting COVID. But the CDC has gone ahead and said people who are vaccinated can get together outdoors without a mask with other people that have been vaccinated. It's already been the case. And I think this is really important for working people. If you come in contact or in close contact for over 15 minutes with somebody with COVID, then you're normally asked to isolate for 2 weeks. Well, the CDC feels if you're vaccinated, you do not have to isolate. So, that could cause some people to miss 2 weeks of work if they contact somebody with COVID. So that's a benefit as well. I see Steve's put up a chart that'll, you can visit a barber or hair salon. You can go to uncrowded indoor shopping center, museum, ride public transport, attend small indoor gatherings, fully vaccinated and unvaccinated people from multiple households, indoor movie theaters, full capacity worship service, sign an indoor chorus. Oh, sing in an indoor chorus. Thank you, Ryan. Eat at an indoor restaurant or bar, participate in indoor high-intensity exercise classes. So that's a lot of activity, and it makes me want to get vaccinated all over again. Maybe I'll be able to do even more stuff.
That's scary.
One of the things I talked about this last week, and I hope it doesn't come to that here, but in Israel, you basically get a green card if you're vaccinated, and you can go inside in a bar or a restaurant. If you're not vaccinated, you have to eat outside on the sidewalk. So they've kind of created a difference between the two groups of people. I hope that it doesn't come to that here. But it is worrisome that we're going to peak out at around 40% of vaccinated people. I feel like we're getting to the end, like we're getting close to the point where everybody who wants to be vaccinated has been vaccinated. Mm-hmm. I almost feel like it's time to have what do stores do? They have a closeout sale, going once, going twice, come on in and get vaccinated. But of course we don't want to do that. We want to keep offering the vaccine.
But you are starting to see that, yes, it has plateaued, but we are heading into that summer season. We've already talked about the fact that the fair is going to take place. I'm hearing more and more about concerts that will take place. Now, the venue, depending on the venue, they're doing it different ways. There's a few venues out there that are kind of creating these pods of people where you're going to do it. They're talking about having, I forget the exact number, I want to say around 140,000 or so at the Motor Speedway for the 500. That's just about 4 weeks away. And figuring out ways to be able to do that. They won't have people on the infield. They'll spread them out a little bit in the stands. It's a large place, so they can figure out how to do that. I think that's where we are right now. Sounds reasonable enough if people, because you don't know that all of those people are vaccinated.
Exactly. You don't know who's vaccinated and who isn't. There's no way to tell. But it does sound reasonable. For whatever reason, our percentage positivity rate is very low, and I want to keep it low. And that's how we can do it, by continuing to use sensible measures when we're around other people.
Okay. If you want to get vaccinated, the J&J or Moderna is available through the Wayne County Health Department Tuesday, Wednesday, Thursday.
That's right.
And walk-ins at either their location or at the Coleman Center, and also there's various other places, urgent care, things of that nature. You all have it available also.
Yep, that's right.
Okay.
Come and see us.
Go see them. They're lonely people. Go see them. If you need some more information, there were some numbers there on the screen. Definitely check that out. Dr. David Jetmore, Wayne County Health Officer. Thank you, sir. Always good to see you.
Good to be here.
Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health. Taking off a week.
I am. I will not be here next week.
That's the first one in
we're gonna,
50. I think this is week 57.
I know. It had to
56
happen
or 57.
sometime. But next weekend is Mother's Day weekend, as you, I'm sure, are well aware. And we are going to drive up to Cleveland and spend it with my daughter.
Okay. Too bad you're not there this weekend. Are you a football fan? They started the draft last night with lots of people.
I was. My phone was going off with texts all night from people in my fantasy football league.
There you
going
go.
on about it.
Okay, so a couple of things to remind you. If you need a ride, Roseview Transit is still offering free rides. If you need a ride for COVID, be able to do that. We've talked about things reopening. The Wayne County Historical Museum has updated starting tomorrow. They'll be open Tuesday through Friday from 9:30 to 4, Saturday 12 to 4, and you will not need an appointment. Up until now, you've needed an appointment if you were going to do that at the museum, and that's not the case anymore. Free fishing days will be going on, so you can go fish beginning May 2nd, June 5th and 6th, September 25th. Fish at the state's public waters without a fishing license. So again, weather's good, get outside and enjoy it. We will be back next week with another edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Dr. Jetmore will be here, and we'll figure out somebody to put in that seat. Enjoy your trip. Thanks for watching this week's Ask the Doctors. As always, I wish you well.